Ladies and gentlemen, please warmly welcome to the podium the Executive Vice President for USF Health and the Dean of the Morsani College of Medicine, Dr. Charlie Lockwood.
Welcome. It is an honor to address you on this memorable occasion. Let me begin by thanking our outstanding faculty, staff, donors, and alumni for their dedication to our program. I would especially like to express our gratitude to Carol and Frank Morsani, who are in attendance today, for their invaluable support of the USF Health Morsani College of Medicine and its students. Let me also recognize the parents, family members, friends, and loved ones of this remarkable class. You have been the students' chief advocates and principal supporters, so thank you for making all this possible. A hand for your family. But most importantly, please join me in welcoming the 50th graduating class of the Morsani College of Medicine, our class of 2024. Congratulations, doctors. As your dean, it has been my unique privilege to watch your progress over these 4 often challenging years, and each of you should take great pride in reaching this milestone. You have arrived here today because of your sustained commitment to the noble goal of becoming a physician, and your stoicism has paid off. I speak for all of USF Health when I say that we could not be prouder of you. Your class set new standards of success in research productivity, national board scores, and residency matches. But we are especially proud because you are the class that has already proven its grit. I fervently hope that one day, soon, we will be able to stop defining moments in healthcare by the pandemic clock. But you all did something really remarkable. I'd like everyone to recall that the students you see here today entered and chose to enter medical school shortly after the pandemic began, a time when healthcare providers were suddenly faced with the greatest medical crisis in a century. Our USF Health physicians worked around the clock, quarantined themselves away from their families, and literally lived in the hospital for weeks to care for critically ill patients. And these students stared into the face of the pandemic and said, "I'm all in. Sign me up." These are doctors who looked upon a global conflagration and ran into the burning building. These are doctors who entered this noble profession because they were firmly committed to helping to heal the world. Now, as you go forward into your medical careers, I hope you'll remember the lessons we tried to impart here. First, you've all heard me say that knowledge doubles rapidly, at least every 73 days, and I think I probably told you that at least every 73 days. That means that remembering every fact you learned in medical school is not enough. What you discovered here is that you must be a lifelong learner. Second, 83% of what you read in the medical literature will never enter practice. So you must be a critical thinker and able to curate the literature, discern what is important and what is not. Physicians ahead of you have already had to adapt to change. Think about just a few of the things we do right here at Tampa General Hospital, our wonderful teaching partner. Pioneering new organ methods, fixing leaky heart valves without surgery, performing in utero laser therapy to correct twin-to-twin transfusion syndrome and save the lives of 2 fetuses, treating certain cancers with immunotherapy instead of traditional chemotherapy and radiation, applying ultrasound waves to the brains of patients to correct tremors that are so disabling they often can't sign their names. All these things were unknown a generation ago and may well be out of date a generation hence. That is why you must be open to new ideas and never stop questioning their validity and continued relevance. To be a critical thinker, you must avoid cognitive shortcuts. In his classic book, Thinking Fast and Slow, the late Nobel Prize-winning psychologist Daniel Kahneman described how our brains have 2 systems of thinking. One, superficial, emotionally charged, fast, and prone to ascertainment, anchoring, and confirmatory biases. The other, deep, dispassionate, slow, evidence-based. In other words, critical thinking. Thinking a bit more slowly would benefit people in all walks of life. The difference for physicians is that when we use mental shortcuts, when we fail to think deeply, we are prone to these heuristic biases that can harm our patients, like performing wrong site surgery or mistaking a patient's fever for the flu rather than potentially lethal sepsis, or dismissing the possibility that a woman reporting back pain may be having a heart attack. Critical thinking was a child of the Enlightenment, and it fueled the scientific revolution, but it is as important today as it was in the 17th and 18th centuries. Critical reasoning is vital to caring for our patients, in teaching our students, and in conducting scientifically valid research. But it is also vital to our conduct as citizens. Greg Lukianoff, who you'll hear from in just a few minutes, has committed his career to the preservation of critical thinking and free expression in academia, including academic medicine. In his newest book, The Canceling of the American Mind, Greg and his co-author, Ricky Schlott, provide a frightening number of examples of how many institutions of higher education have failed in their duties of preserving 350 years of critical thinking, Enlightenment rationality, and of teaching us how to argue productively. Of course, social media has only made the problem worse. Ironically, Lukianoff's work shows that the large majority of Americans think that cancel culture on the left and the right is a bad thing, and that Americans value free speech as a vital part of a healthy democracy. And yet today, instead of discussing the substance of our disagreements, we too often launch personal attacks or retreat to what the authors refer to as a rhetorical fortress, to dismiss arguments without debate. The walls of these fortresses allow us to stop listening to those who don't share our ideological outlook, or who belong to the wrong political party, race, gender, or sexual orientation. So I ask you never to be afraid to challenge dogma in ways that elevate discussion, knowledge, and learning, to always be open to challenging ideas, to never retreat to rhetorical fortresses, and to always engage in critical thinking. And as physicians, be relentless in seeking the correct diagnosis and optimal treatment for your patients. Be fully honest with your trainees when you don't know the answer to their questions, which happens to me quite a bit, and be fearless in your pursuit of novel research concepts. Shakespeare wrote, "Love is an ever fixed mark that looks on tempests and is never shaken. It is the star to every wandering bark." As physicians, our guiding star, our ever fixed mark, must be the pursuit of truth and scientific rigor with dispassionate reason. Follow that light as you go forward in your medical careers and in your everyday lives, and you will truly help to heal the world. Thank you.